Hello! Do you ever feel like there's something stuck in your throat, something you just can't seem to clear? Well, you're definitely not alone. In this explainer, we're going to uncover the surprising reasons you might be constantly clearing your throat. It's a really frustrating sensation, isn't it? It can get in the way of your day, affect your voice, and just be a constant annoyance. But what's actually causing it? You know, it's natural to think the problem is your throat, because that's where you feel it. But most of the time, that's just the symptom's location. The real culprit is usually hiding in one of two places, your stomach or your sinuses. So, we're going to investigate the two most common causes of this issue, and you'll see neither one actually originates in your throat. Let's dive in. Okay, so let's get right to it and look at our two primary suspects for where this phlegm is really coming from. Think of that phlegm as your throat's defense mechanism. It's a protective layer of mucus your body creates to shield itself from irritation. So the real question is, where is that irritation coming from? Is it coming up from your digestive system, or is it draining down from your sinuses?
First up, let's open case file number 1, the digestive system, and a condition known as GERD.
So what is GERD? Well, imagine there's a small valve, a sort of one-way door, between your stomach and your esophagus. With GERD, that door doesn't seal properly, which allows stomach acid to splash back up, irritating the very sensitive tissues in your throat. And when that acid hits the delicate lining of your throat, your body's defense systems kick into high gear. The response? It produces a thick coating of mucus to protect itself. And that mucus is the phlegm you feel.
Now here's a really interesting point from the source material, and it might sound a bit backwards at first. The theory is that the problem isn't always too much stomach acid, but sometimes too little. You see, your stomach needs to be highly acidic to send a strong signal for that valve to clamp shut. If the acid is weak, that signal is weak, and the valve stays partially open, allowing for reflux.
Okay, so that's how your stomach can be the source. But what if the irritation is coming from the other direction? Let's open our second case file, post-nasal drip. We all produce mucus in our nasal passages. It's totally normal and helps trap dust and pollutants. But when your body starts producing too much of it, that excess mucus can start dripping down the back of your throat. That constant trickle is what we call post-nasal drip. So why does the body suddenly start making so much mucus? It's usually a response to some kind of irritation or invader in your sinuses. This could be anything from a virus or bacteria to fungal growth or even just environmental pollutants. Sometimes, these microbes get clever. They can build these protective shields called biofilms. Think of it like a slimy fortress. This shield makes it much harder for your own immune system and even antibiotics to get to them, which can lead to very persistent sinus issues. So we have our two main suspects, GERD and post-nasal drip. But what else might be contributing to the problem? Let's zoom out and look at the bigger picture for a moment. Now, antibiotics can be lifesavers, but they can also be a bit of a double-edged sword. While they kill off harmful bacteria, they don't really distinguish. They can also wipe out the beneficial bacteria that help keep your body in balance. In a healthy system, you have a large population of these helpful bacteria. Think of them as peacekeepers. They do a great job of keeping other things, like fungal growth, in check. But after a course of antibiotics, those peacekeepers can be severely diminished. This creates an opportunity, an environment where fungi can overgrow, potentially leading to chronic inflammation in the sinuses and that constant mucus drip. So, how do you begin to figure out which of these might be your issue? The key is to start paying close attention to your body. For instance, do you notice the phlegm gets worse right after you eat? That could be a clue it's related to your stomach. Or is it at its worst when you first wake up? That might point more towards your sinuses. Now, the source material discusses several supportive strategies that may help. It is absolutely crucial, however, to remember that these are not a substitute for professional medical advice. Always discuss any new approach with your doctor first. For sinus-related issues, things like nasal rinsing with a simple saline solution can help flush out irritants and thin out that thick mucus. The source even mentions using a highly diluted baby shampoo solution, with the idea that it may help break down those stubborn biofilms we talked about. On the other hand, if you suspect your stomach is the issue, awareness of your diet is key. Many people find relief by identifying and reducing trigger foods. Common ones often include dairy, sugar, and spicy foods. So really, the most important takeaway here is to shift your perspective. Try to stop seeing the phlegm itself as the problem. Instead, view it as a signal, a message from either your digestive system or your sinus system that something is out of balance. And of course, please remember, this information is for educational purposes. It's meant to help you understand the potential causes of a common symptom, but it's not intended to be a diagnosis or to replace the guidance of a healthcare professional.
The question to ask yourself is, what is my body trying to tell me? Is this signal coming from above or from below? Working with a qualified professional is the best way to investigate that question and find a lasting solution. Thank you for joining this explainer.